Hey guys, so I just want to make a quick video. I'm 9 days post-op now, and I didn't make one earlier, but I did take pictures of the progression of how it's been healing. I was actually in the hospital for almost 5 days after surgery due to complications. Obviously things did not pan out as I would have liked them to. What happened was everything went great with surgery. There was no complication whatsoever with surgery. Doctor Huge McLean is fantastic. All his team there are phenomenal. I mean, can't say anything bad about them. Their bedside manners are phenomenal. They, tend to you like they don't think of anyone else. When they're with you, it's full attention to you, and they do everything they can to keep you comfortable. Normally when I wake up from anesthetics, I'm very disoriented, I guess you could say. I wake up and I normally panic and I need my mom beside me like instant. Like, I wake up and they have to get my mom. And I always tell the doctors before any kind of surgery I have, anytime I undergo anesthetics, that when I wake up, you need my mom beside my bed because I will ask for her. And they always say, oh no, you'll be fine, our anesthesiologists, they're good, you won't have any problems. And sure enough, 2 minutes after I wake up, they are getting my mom. And surprisingly enough, I mean, I did ask for my mom when I woke up with them, but I knew it was going to happen, but I was not in any pain. And normally when I wake up from surgeries, no matter what it is, minor or not, when I wake up, I am still in a little bit of pain because, I mean, you just got cut open, right? I was in no pain whatsoever when I woke up. I had no pain, like, not even a 1 on a scale to 10. It was 0, like, no pain at all. And you think, I mean, you would, right? Considering I had the double mastectomy. I didn't have the keyhole procedure or anything. But no, I was in no pain whatsoever. I did, however, ask for my mom, but that was just a comfort thing. I needed her in the room to see that I was okay. I think it was more for her that time than it was for me. I needed her to know that I was okay. Everything had gone well, no problems. However, once I woke up, I started coughing up blood. And that is not a good sign, no matter what. So yeah, and for the nurses and Doctor Huge McLean, they had no idea what was happening because they've never experienced this before, and it was new to them too. So they stood by my side. I had 2-3 nurses beside my bed the whole time. I actually didn't even come out of the recovery room that you go into right after surgery. Like, they have a recovery room, and then they actually put you into like another recovery waiting room kind of deal for an hour or so, and then they make sure everything's going good, you're stabilized, and then you're able to go. So it's a 2-hour procedure and then a 2-hour waiting after, and normally you're good to go. Well, I didn't even make it out of the recovery room in the back because of me coughing up blood. Dr. Huge McLean, he sent me for x-rays. There's actually a hospital not even 5 minutes away from his clinic, so he sent me right over there. They didn't waste any time. I was there with them for maybe an hour or two after surgery. They were keeping an eye on me, and it wasn't subsiding. I mean, it wasn't as heavy. It started to become a little clearer, not clear, reddish. It wasn't as dark and thick. But he still, let's take precautions, send you to the hospital, have some x-rays, make sure, everything's okay, there's nothing wrong. And so I went, I had x-rays done, and, they didn't tell me to stay. After x-rays, they said, they didn't ask me to stay. They did x-rays and they said, you're good to go. So, thinking everything was okay, we left, and I was actually almost at my friend's house because my friend came with me, and I was actually going to her house after, and I was going to stay at her house because she lives about 15 minutes away from the clinic, and that way, when I had to get my the sponges off, I could just go. I didn't have to drive back because I live so far away. I live about 3 hours away from the clinic, so yeah, it was much easier to just stay there with her for the 2 weeks rather than wasting the gas coming up and down, especially if there was any kind of complications. Luckily, well, not so luckily, I guess, there were complications, so it worked out in my favor that I was staying up here anyways. So what happened was, we were almost at her house, we were about 5 minutes away, and we get a call from my mom, who actually just spoke with the hospital, and they said he needs to get back here right now. So, you know, we're kind of panicking, like, what's going on? They didn't tell us anything that was happening. So we turn around, 15 minutes back to the hospital. We get to the hospital, and it seemed like an eternity because we hit every red light on the way there. We get to the hospital, like, go in, and what happened was they said go right up to the registration, don't wait in line, get up there and get in because you need to be admitted to the hospital right away. So I went up to the counter. I cut in front of someone. I mean, I feel bad because I don't know what their situation was, but I had a pretty serious situation, so I said I'm sorry. You know, I went up and I said, hi, I'm Christopher, and I just got a call saying I needed to come back here. I had x-rays on my chest and something's wrong. And she said, Christopher, yes, we were looking for you. We've been looking for you all over the hospital. So she got me admitted. She was actually really awesome. She was like, so what's happening? Like, what's going on? And I said, well, I just had surgery. I explained, you know, what the surgery was and everything. And she was actually really, I didn't expect it. I mean, I kind of, you know, it wasn't too shocking because it is a bigger city, so people are more open-minded. But where I'm from, it's not as open-minded. It's different. So, no, she was like, oh, that's awesome. I actually just watched a show about, you know, trans guys, and, you know, it's so cool, and I'm so proud of you. I'm glad you can, you know, be who you want to be, and, you know, everything. Like, she was just really, really supportive of the whole thing, and she was like, you know, here's your bracelet. She got me in right away. She's like, we need you to come back in this room. I had a doctor see me right away, and he told me, actually, that there was severe abnormalities with my lungs, and, actually worse in my right lung, that they need to do a CT scan because the x-ray wasn't clear enough for them. So we had no answers. We didn't know what was going on. We just know there's something really wrong with my lungs, which is causing me to cough up blood. I mean, I wasn't throwing up blood, but I was coughing up blood. And so what happened was, you know, I was waiting there, and I had to have the CT scan. So I was in my own room, like, it was in the emergency area. It wasn't actually, like, a room in one of the areas of the hospital. It was just the emergency area. And so I was in there for a bit. You know, they got an IV in, they took blood, they, you know, hooked me up to the IV, running fluids in me because I was so, you know, I haven't eaten already for 24 hours because of surgery, and then on top of it, you know, I can't eat or drink anything because I'm coughing up blood, so they don't know what's going on. I can't eat or drink anything. So I'm hungry, thirsty, you know, dehydrating. My mouth is so dry I need something to drink, but I can't drink anything, so they're pumping fluids in me. I ended up going for the CT scan, and after the CT scan, I came back to the room, and they had a doctor looking at the CT scan, and they said, yeah, it pretty much just confirmed with us that there is something wrong in your lungs. We don't know what it is, but there's severe abnormalities, which is worse than knowing what it is because you don't know what it is, you don't know how severe it is or how minimal it could be. So it was actually very frightening for me, my mom, my sister, my sister-in-law, and my friend that were there. We were all very concerned. I mean, I was terrified. I didn't know what was going on. So I'll give you a little time frame. So my surgery was at 9:30. I left there at 3 o'clock, went to the hospital, and, you know, had my x-ray, whatever, left, and came back, and I think I was back there around 4:30. The doctor came in and talked to us around, I'm gonna say late, it was probably like 9 o'clock at night. He came in, and he asked my mom and my friend to leave the room, and they would only let me have 2 people back there at a time. So my mom left the room, my friend left the room, and he goes, you know, he asked me questions like, do you smoke, do you share needles, do you do drugs, do you, you know, all the questions I need to know, so they can see what the hell's going on, right? You know, and then he goes, well, we're not sure what it is, but it looks like it could be blood clots in your lungs. For all of you who don't know, that is very severe. That could be deadly. They'll have to give you blood thinners, hoping that they can get all of it out. If not, you know, it could be very deadly. What frightened me even more was my grandma and grandpa both died from blood clots.